Right. Well, I'm going to send you the sign in link now. And I'm going to give you, so please do not copy and post it again. Just sign in, you click the link and sign in yourself. If you want to copy to your computer, you can. Now you have 3 minutes to sign in. It's simple. Just make sure that your name is right, your email is right. Okay, that's it. Yep. Awesome. Let's see that most of you sign in already. 67, 70. Okay, you don't need to let me know that you have done it. You don't need to let me know you have done it. Because if you post anything, you have done it, and then what happened is the other people can't see the link. So don't post anything. You don't let him go back to your email and make sure that you have received a confirmation email from sign in link. Okay, from I'd say that Dizziness. We have tested our system, no problem at all. The link we just posted. I just post the link. Do not tell me you have done it. I post it again. Here is the link. And this is only for New Zealand acupuncturists. If you're not in New Zealand, you don't have to do it. It's not for you. Okay? Thank you. Check your mail. Check your junk mailbox. Check your junk mailbox. And then make sure your email is right. We have tested our system. Nothing wrong with that. We have 118 people sign in now. 119. For those of you haven't got the confirmation email, you can sign in again. You should directly receive the email. You can sign in again and make sure you get your name right and your email address right. Otherwise, you won't get any confirmation email. Okay. The 127. Tesunam, I think your yep. I can confirm we have sent you the sign-in confirmation email. I don't know why you haven't received it. Your account is Meridian Therapy. You put it in here. Okay, that's it. Let's start. It's better you use Gmail. Gmail has no problem receive our email. Okay, some other like some people in Taiwan or China email service, and then sometimes you don't really receive it. I don't know why. Okay, let's start. I post it again for those people who just sign in. Okay. So what is Can you see the presentation? Um, the PowerPoint? Yes? Okay, good. Thank you. Right. What is dizziness? Dizziness is the feeling of being lightheaded, woozy, or off balance. It's linked to the sensory organs, uh, specifically the eyes and ears. So it can sometimes cause fainting, pass out. Dizziness isn't a disease itself, but rather a symptom of various disorder. So symptoms related to dizziness: people who are dizzy may experience various sensations, including lightheaded, lightheadedness or faintness, a false sense of spinning, okay, unsteadiness, a loss of balance, a feeling of floating. Sometimes dizziness is accompanied by nausea, vomiting, or fainting. Dizziness causes benign positional vertigo, BPV. For the BPV, they have an exercise for it. It's very good. If they can perform the BPV, then they'll be all right. Okay. And even um, with the BPV, you don't need any acupuncture to treat it. But can we treat it? The question is, can we treat BPV? Can acupuncture treat BPV? My question, can acupuncture treat BPV? I think they exercise better than acupuncture, in my opinion. Okay. But if they can't perform the exercise, I don't know how to do the exercise, but you can learn. I haven't learned it yet. It's not hard at all. Okay. But some people can't perform it because the dizziness is too much for them. They can't even lay down, and they have to require lay down and turn to one side and then stand up and then go to the other side, something like that. It's easy. You can go online YouTube. There's a lot of video. I just haven't learned it yet. Okay, I think I can, but I just patient, they come to me and they've been someone else and they can do it. Some patient they can do it themselves, and I say, well, you just get them to do it. And a patient come in to me with BPV. The reason they come is not because BPV doesn't work for them. It's because they can't perform BPV exercise. It's not because the exercise doesn't work for them. It works perfectly, but they can't perform it because the dizziness is too severe. So that is something that we can do for them. Quickly reduce the dizziness, and then they can perform the exercise for it. Okay, I just want to make it clear in here because I do think they exercise better for sure. Mania disease. This is something that will cause dizziness or vertigo. Dehydration, migraine attack, alcohol, medication, antihistamine, or a lot of other things you can read near stroke, blindness, tumor, brain disorder. There's a lot of here. Okay, something you can see that's covered, or even an ear infection, anemia, low blood pressure, heart attack, circulation problem, too much exercise, you know, heat exhaustions, decrease in blood volume, like if you lose a lot of blood, It may happen to women who have heavy period. You can't stop it. Anxiety disorder, motion sickness. You go on a boat or car, seasick, Parkinson disease. Okay, something like that. So it's I'm not going to go deeper because what we're going to do today is just focus on the symptoms. Is there any way we can get instant relief for patient using distal point strategy? Okay. So I'm not going to go deep. What is dizziness and what causing it? There's a lot of them, and then you should be able to find. Doesn't matter what it comes, and acupuncture should be able to get instant relief for this patient. Okay. Mm, so it come to I need to post another time of sign in. Have anyone signed in so far? 158 acupuncturists joined. I'm gonna post it again. If you haven't signed in, please sign in. With 143 people here. So if you haven't 144 now, sign in 144, and we have total 155 join us. I believe some of them are from overseas, not in New Zealand. 145. Okay, make sure you do um, receive the confirmation email. Okay. Right. Let's back to here. Okay. Now today we're going to go for acupuncture 1, 2, 3. So acupuncture 1, find out sick meridian. Acupuncture 2, find out the balanced meridian or treating meridian. Okay. Through 6 system. Acupuncture 3, point selection. Okay. And the main one we're going to do is for the based on holographic points today, right? At first, acupuncture 1. This is called heat 3 points, instant relief dizziness. It can also work for headache or migraine. Okay, acupuncture 1. Let's have a look on the heat. How many meridians go through the heat? So how many meridian on the heat? Question. How many meridian? 8. Awesome. Christine, thank you. Okay, 8, which means all young meridian. Hand 3 in doesn't go to heat. They don't go to heat. Foot 3 in don't go to heat. Okay. Only, not only, the meridians go up to heat, including hand 3 young meridians, foot 3 young meridian. That's 6, right, in total. Then plus 2 meridian and run meridian. Okay, run meridian up to here. So that's 8 meridians. Look at here, 2 meridian, 1 meridian. But when we talking about dizziness, It's more on the brain, on the ear area. Okay, so we're not discussing run meridian. Maybe run meridian, but we're not discussing it in here. So I put a cross over here. We don't count run meridian in general. Same as headache. And what other meridian? On the foot 3 yang, the stomach, gallbladder, and bladder. And the hand yang meridians, including large intestine, sanjiao, and small intestine. Okay. Now, this is acupuncture 2. So on the acupuncture 2, we want to find out what meridian can treat all these 7 meridians on the head. Now, my question for you: how do you on um, the dizziness? Okay, it's hard to pinpoint which meridian caused the dizziness, right? Can you tell which meridian? If you ask patient, oh, you suffer from dizziness, can you pinpoint, oh, this is a dual meridian causing the dual meridians issue that causing this dizziness? Or, hey, it is stomach meridian that only runs through your head, that's blockage that causing the dizziness. Can you make a diagnosis of this? Do you know how to make a diagnosis? Directly tell which meridian that causing dizziness. Well, you can't pinpoint where the dizziness is, right? It's on the whole head. Am I right? Does it make sense? It's not like headache. Headache, you can pinpoint, oh, it's over here. That we know as a Shaoyang meridian, right? You say, well, it's over here. The headache is over here. Oh, okay. This is Shaoyang meridian, and this is actually foot Shaoyang. This is gallbladder meridian, and oh, the headache is actually over here. This is on here. Oh, this is UB meridian. Does it make sense? But it's dizziness. It's on the whole head. You can't pinpoint it. Therefore, we treat all the meridian on the head. Go on the head. Does it make sense to you? If it does, please reply 1. Yeah, you asked location of the pain, but in this case, it's the dizziness. There's no pain. This is feel imbalance. Yeah. You can't ask where is the pain because there's no pain unless they have some pain with headache. Okay. So that is why we treat all the meridian up to the head. Okay. This is acupuncture 2. Now, heart meridian. Heart meridian can balance gallbladder as well as small intestine. That is through the 6th system, according to balance method acupuncture. In pericardium meridian, it can balance stomach meridian as well as sanjiao meridian. And it can also balance dual meridian and run meridian. Although we said that we're not counting run meridian as sick meridian in this case, but I just added all in and let you know. If we're counting run meridian, don't worry. Pericardium meridian can take care of it. Can also take care of it. Lung meridian can balance bladder meridian, run meridian, and large intestine meridian. So if you go through it, you see foot 3 yang, we have gallbladder, stomach, and UB. Hand 3 yang, small intestine, sanjiao, and large intestine. And that's in total 6 meridian plus 2 meridian, 7 meridian. So the acupuncture tool, if we just apply 3 meridian, which is heart, pericardium, and lung, those 3 meridian can treat all 6 meridians in acupuncture 1. Right? Does it make sense? Do you get it? Are you following? If you are, please reply 2. Simple, right? This is how we find out. Otherwise, you have to needle what? 12 meridian or 7 meridian? We only needle 3 meridian and take care of everything. Take care of 6 meridians. Right? It all makes sense, right? Okay, this is the beauty of distal point strategy. You go through the theory, acupuncture 1, 2, 3, and then you know using a minimum meridian, balanced meridian, that can treat a lot of sick meridians. Okay, let's keep going. Now, this is acupuncture 3. We know the meridians already. We know which meridian to treat, but we need to find out a point. And the point is an acupuncture 3. In the acupuncture 3, in this step, we use holographic image. As you can see here, the belly button, navel, that we can, if anything on the belly button, we can use knee joint or elbow joint to treat it. If anything on the neck, then we can use ankle or wrist to treat it. So head is on top of the neck, right? That if ankle is neck, represent neck, then foot is represent, including toes, is representing head. And hand and fingers are representing head as well. Right? In this part, does it make sense to you? Okay, look at here. This is a puppy show. Hi everyone, I am Szenan. Right? This is a puppy show on the TV when I was little. That people, they're still in TV program now. Sometimes I still watch that, you know. So it's just a puppy show. And then this elbow is my belly button. That's the belly button over here. And you see I'm knocking my head. This is my neck. And this is the head. So the whole hand representing head. Right? And again, over here, ankle, the neck, and the whole foot, right? We upside down the model, the whole foot representing the head. So which means we can choose points around here to treat any head problem. You can treat dizziness, headache, eyes problem, ear problem, mouth issue, sinus problem. We can choose the point over here. Okay. Does it make sense? If you get it, please reply 3. Simple, right? Not hard at all. And at which point, the question is, which point are we choosing on those 3 balance meridians? So here is the point that I show you. The very painful one, or 金wow point, 少冲中风少商, which is heart 9, pericardium 9, and lung 11. Well, heart 9 is over here, right? Pericardium 9 is over here, and lung 11 is over here. Now I know it's painful. Have any of you in your practice that been needling those 3 points to treat headache or dizziness? If you have, please reply 4. If you haven't, please reply 5. You have. Awesome. Some say 5, 4, 4. Okay, good. Okay. Now, if you haven't applied it, could be one of the reasons it's too painful. Isn't it? Is it too painful? Is it the reason that you don't use this point because it's too painful? If it is yes, please reply why. Yes. Why? Yes. Okay. I get it. Totally get it. Okay. Now, I show you this point, but I know you may not use it because it's too painful. For headache, you can use it, no problem, because they have a lot of pain. They don't not so care about this pain, and they feel the pain. It may help to get rid of this. For the dizziness, they're not feeling any pain. They're just dizzy. If they stop in there, some patients they're fine. They're not getting dizziness. But if you want to put all this point, the first time probably okay. The second time they don't want to come to see you because it's too painful. It's too painful, right? Now, what can we do? You see, I said the whole hand represent heat, right? Then what can we do? We can go to the joint from here, right? You go to the joint over here, the finger joint. And here, you go to the joint over here or here. And for thumb, you go to the joint over here. So when you move the Jingwell point to the joint, less painful. So you can needle it. Does it make sense? Okay? So you can move it to the joint. And when you needle, you don't use long needles, you use short needle and thin needles. I suggest I've got 0.16 over here. Or I use 0.18 or 0.20 or 0.13. Very thin needles. And then very short needles, I use 15 mm. I've got a lot of 15 mm in the clinic, so I use those little needle. Okay? The needle. Yeah, very short one. Those needle, quick one. And how, even over here, it could be painful. How did you get your patient? How do you needle without pain? Tube? Even with tube, it's still painful, right? Can you freehand needle it without any pain? Share your technique with everyone. I'm here to share. I want you to share with me any technique that you can do that with less pain or pain-free technique, the insert needle. We all say quickly insert it, right? Quickly. How quick can you, if you needle Jingwao, can you quickly needle it without any pain or very less pain? And people, the patient can accept those pain, even with dizziness. Do you have any technique? If you just get the patient there and they needle it, it's painful. Unless you have wonderful technique. For most of our, we still get pain, right? Okay, massage and fix first. You massage it and then give your fingertips, think your nail to do it. This is one. This is one a good way. You can massage the tip first and then can use your finger, the what do you call it? Um, the fingernail, and to give it a bit of stimulation. And then before you do that, that's good one. Thank you. Thank you for sharing. Anyone else? So one of my way to do this, have you heard about, people always say, get your patient to cough or sniff or cough, needle it. Lift up the skin a bit. Yep, that's one. It's still painful, even though you lift up. I can pinch the hand very hard. I needle it. It's still painful. Have you ever tried coughing or sniff? Applying 0.16 7 nm is not that painful. Yeah, it's not that painful. I agree, but some patients still quite painful. The smaller one, the better. For some very sensitive patient, they still get painful. Headaches is okay. You treat migraine, you treat headache, you do this. If they aren't very painful, if they come to you, they on such a lot of pain, you need no complaint. They feel better. But once the headaches reduce and they come for follow up, and they haven't got any pain or just a little bit of pain, just 1 or 2 out of 10, or just a bit of fogginess, a bit of fuzzy, and you still use those pain needle for them, and you scare them off. They're too scared for those, too painful. Yeah, coughing wood. Absolutely coughing wood. But there is a better way to do this with coughing. Okay. My way of doing this, I teach it in my class, in my workshop. Okay. It works all the time. I do it on my clinic. It works all the time. Patient doesn't mind so much. So again, when you apply this, I'm not asking you to use the long needle and thick needle. It's still painful. It's a matter of taking the mind of a patient. Taking the mind off and get some restriction. This is what I do it. Okay, I would like to share with you. So um, you can do whatever you do. The suggestion that we just mentioned about, I don't normally do that. Okay, what I do is I get very fine needles. I freehand needle it, or I can use guide tube, and do that. Okay, and I ask my patient, cough 3 times and hard. When you ask the patient to cough very hard 3 times, they're focusing on the coughing, not just one. Why not just one? Because if you cough one with your needle inserting on the point, and you have to get the right timing. When they cough, you needle it. Harder to get timing. Okay? So the way to get them 3 times for practitioner will be easier to get the timing right. Number one, easier to get the timing right. Okay. Number two, when they cough more after you insert it, they are focusing on the coughing rather than in here. Okay. This is what I do. You ask your patient cough 3 times first to understand the timing. You know, it's my timing. Okay, 3 times. And I say, on the second time, you needle it. First time you don't needle. The second time you insert needle. The third time you let go your hand. Okay, this is what we do. This is a slow one. We say, you see what I mean? So I'll perform it again. I'll show you again. You ask the patient to cough 3 times, then you know the timing. Does it make sense? Do you get it? If you do, please reply why. Yes. I find that this way is easier. When you come to any point, kidney 1, 涌泉 point, any sensitive point over here, you know, pericardium age, heart age, easy, easy. If you want to get the timing right, you can use, the guy, the tube, and you put it in there, your needle put it in there, and ask patient to cough 1, cough 2, and then cough 3, something like that. Okay, easy. You can needle it. I use it all the time, but because of COVID, when COVID happened, and then you don't want the patient cough in front of you or face to you, right? Some patient cough, they don't actually put their hand to the sideway, they cough to your face, and you don't want that happen. What do? Sniff, sniff in, right? And you want the patient cough hard, and you want the patient sniff hard. Focus on the sniffing. Okay? If you're afraid of coughing, you don't want patient to cough the ear to you, get them to sniff. Does that make sense? Evan said, I will just let the needle sit on the skin for 10 seconds. I will ask my patient to have a few easy breaths. This way, the point is already accustomed to the stimulants. Then gentle tap it in. A lot of it is intention. All right, good way. Thank you for sharing. All right, Evan has a good way as well, so we can all learn from here. Thank you, Aaron. Thank you for sharing. All right, this is my way I share with you. Okay, again, this is the point that I showed you. It will work very well for headache. It will work very well for dizziness, but it's very painful. Right, and I have shown you how to needle it, a pain-free technique or less pain technique. Okay, I hope if you needle this, you do apply those technique. If you don't, then your patient run away from you. Don't blame me. Okay. Next. Now this is a local point strategy. Only 3 needles. Okay. Now we find that it's even better with magical 12. This strategy is even better because with the local point strategy, it's good to take care of the symptom. It's fantastic to get instant relief. But most of the dizziness, if they have it for a while, if it's caused for menial disease or high blood pressure, it is a symptom, but are you just treating the symptom, or you want to get rid of the organs issue? You want to balance the organs issues. If you want to balance the organs, you want the result last longer, then what happened? Use magical 12, global balance, because global balance not only take care of the local problem, it take care of the organs imbalance. If you have a way to find out which organs out of balance, if you don't know how to diagnose which organs out of balance, then you can directly go and treat the organs. If you're not quite sure, then apply magical 12, which I'm going to show you right now. Here you go. Now you see, on the right hand, that is in meridian. The 3 point that I just showed you how the needle, heart 9, pericardium 9, and lung 11. This is on the right hand. It is over here. And on the left hand, I suggest large intestine 4, 三焦 3, and small intestine 3. Okay, 合谷中柱后溪. And on the leg, on the right side of the leg, that's young meridian. Stomach 36, GB 34, or Dr. Tan's GB point, UB 40. On the left leg, that's spleen 6, liver 5, kidney 7, 三阴交离沟腹流. Okay. Now, let's talk about, I talk about this on the right side, right? We can use Dr. Tan GB point, gallbladder point, or GB 34. Am I right? Now, if you know how to locate Dr. Tan's GB point, then needle that. If you don't know how to locate that point, that is fine. Simply needle GB 34, which is Yang Ling Quan. Okay? I put it there because it's for my class, so I just copy and paste in there. It doesn't mean you have to needle Dr. Tan GB point. Do you get me? Right. Just back to, right. As you can see here, all 12 meridians in here. All 12 meridians are here. And then we choose 1 point. We choose 1 point of each meridian to target the headache. Okay, let me show you the pattern here. It's very interesting. You see the hand, right hand over here, 3 in over here, and then 3 yang over here on the hand still. So hand and hand treat headache, right? Number 1. And then we move to spleen 6 over here, and kidney 7, full liu, or is on this part. Then on this leg, we move up to here. The point is on here. Okay. It seems like they don't treat headache or dizziness, right? No. There's another image we call big image. We're using here is a small image. Here is the big image. The eyes is the middle. Here, knee is middle. So knee treat eyes, elbow treat eyes. That's why we have knee eyes point in here, right? In here, ankle can treat this level, chin. Hip can treat top of the head. So over here, this part can treat head as well. So the needle over here, stomach 36, GB 34, it treat the brain over here, you see? Or over this part, sorry, and this one. And we reverse it, it treat over here too. And stomach 36 over here, it can treat the head as well. If you look at the big image, right? So apart from that, we all know what is one stone, two birds. In this case, what is one stone, two birds for? All the needles, 12 needle, target the dizziness on the head. Apart from that, stomach 36, very good for stomach and spleen, right? And the spleen 6 over here, it's very good for this area, whatever the organs in here, right? And GB 34 is very good for this area, which is the liver and gallbladder. So it treats the organs as well, right? And large intestine 4, we use this point over here to treat the intestines. Also treat the stomach. Anything that on this level, which is a belly button level, using liver 4 is very good. So it not only treat the head problem, headache or dizziness, it also treat the organs. And you see the points from here, fingers slowly move up to hand and move up to lower leg and move up to the knee, which means this 12 point have been designed to treat this as well as all the organs from here to here. So the organ on the chest, heart and lungs, right? And all the organs over here. It target all the organs. So the beauty of it is if this patient comes with all organs out of balance, this strategy works perfect. Okay, you understand me? I'm just trying to explain to you 12 magical points working very well for the dizziness is because it can balance all the organs all in ones. Do you get me? If you do, please reply 6. Okay. Don't get me wrong. I give you the strategy of 12 magical points. 12 magical points. This 12 magical points, it has many ways you can choose different points. Okay. At the moment, I'm showing you there's 3 in and here. Can I put 3 in and here? Yes. 3 in over here. Do I have to start from the fingers? Can I put 3 in on here? Yes. Depending on the conditions. Okay. And this I teach in my class. There are many different ways to do 12 magical points based on 12 magical meridians and 12 magical points. And I want to explain more to you over here. We have about 12 basic balance and balance method acupuncture. We have 12 patterns. Okay. Now some pattern we mentioned before. Let's say Tai Yin Yang Ming. What Tai Yin Yang Ming means? This yin, this yang, this yin, this is yang. Hand tie in lung meridian, right? We put lung over here. Beijing. Foot tie in spin meridian, spin over here. Fei. Then hand yang ming, large intestine meridian, 大肠. Foot yang ming, stomach. Wait, okay. And this strategy, can this treat dizziness? Yes, it can. Then this is one of the strategy. This is one of the 12 patterns. And here we have 2, 3. We also have 厥阴少阳, Shao Yin, Taiyang, and more. 4, 5, and up to 12. Okay, we have all this, and all those 12 patterns based on only treat 4 meridians. Only treat 4 meridians. Okay. And what happened to here? I'm showing you one of them called magical 12. And the magical 12, we put 3 in meridian here, 3 yang meridian over here, and 3 in meridian over here. This is foot, this is hand, right? And we put foot over here, which is yang meridian. Again, 3 yang meridian. Well, this is treating 12 meridian. This is only treating 4 meridian. And all this 12 meridian only treat 4 meridian. The reason I show you here, because if I show you here, we have a lot of time spent on here, right? And this will target everything. But in reality, if you get instant relief for this patient, can you keep going and use this magical 12 until you fix this patient? Can you do that? My question is no. Why? This is the thinking, the The mindset, that's very important. When you treat, doesn't matter what method do you use. You know, I'm just example in balance method acupuncture. Why, when we treat patient, we use a method, it works, and we carry on, it works, and then patients stop respond to it. There's no progress anymore. Why is that? This is very important. And here, if the patient have lung meridian problem or lung organ problem and stomach meridian problem, stomach organ problem, then we apply only 4. We don't have to apply this one. Okay. If patient have all organs out of balance, we apply this one. Right. Let's say if patient have 12 meridian issues or 12 organs issues combined, that's 12. And we treat them and they get better and better and better and better. And then you have to keep asking questions about patient, how their condition. A lot of conditions are gone, much better, much better, much better. Okay. And then if the patient comes down and just have a sick meridian is lung and stomach, then we have to change the strategy. We're no longer using magical 12. We have to choose Tai Yin Yang Ming and just treat lung, stomach, small intestine, large intestine, spleen meridian. And therefore, the result will keep progressing, getting better and better, and then finally you all better, and then you can discharge your patient. This is the harder one. From here, start with you get instant relief, and you keep treating it, and the patient is much better, and then the patient tell you, I still have a bit of dizziness, but and you keep treating a few more, it doesn't seem to get any further. And this is the time you need to recheck. It doesn't mean if you use this one, you get result in the start, and you can continuing do that, apply this strategy to the end. You may get to the end, and then you send a false message to your patient. You're not going to get better. The little bit, you just can't get rid of it. Okay? This is sometimes because the practitioner didn't actually change the strategy. We have 12 of them. You can change the strategy of the others. Does that make sense to you? Do you get me? I'm just using the example of balanced method acupuncture in here, but this is the thinking, the concept that we all should have. This is my experience in my clinic. I should have this. If anyone hasn't got any further improvement, then I need to think about recheck my diagnosis, the sick meridian, the sick organs, and whether I need to change strategy. This is part of it. Okay. But of course, it could be the patient lifestyle. Okay. That is too much. We can't discuss. Okay. I just want to mention this to share with you. Does it make sense? If it does, please reply 7. Thank you. Right. Okay. For the above, which side to treat. Again, I show everyone this again and again and again. If the patient right shoulder, left shoulder is higher, then you're going to treat. So we all know the structure. There's always structure imbalance for the patient, from the patient, okay? If the patient's left shoulder is higher, then you're going to treat the in meridian of the foot on the left side, okay? This one, in and here. This one means the left shoulder is higher. If you treat this like this is in and here, you change in meridian here, yang meridian here, and this on this orange one, orange color, this means the right shoulder is higher. The right shoulder is higher, so you needle the right leg in here. You get me? The right meridian, the in meridian on the right foot. Once you get this on in meridian here, and the opposite hand will be in meridian, hand in over here, and then yang over here, yang over here. Do you get this? If you do, please reply 8. That's how you choose the side to needle. Based on that, you treat not just meridian and organ, you also balance structure. So this is the a structure imbalance needles, okay? Could I explain it again? Okay, yep. So this is which side to treat. Look at the shoulder. If the patient comes to you, the left shoulder is higher. Left shoulder is higher. This is the left side, right? This is the right side. Okay. The left shoulder is higher, and the foot you treat left on here. The in meridian on left foot. Right shoulder is higher, then the in meridian. Three foot in meridian in here. Then 3 foot in meridian in here. Okay. Then from here, you know how to do the others. Simple. In the opposite hand, in. And those two will be yang, yang. In on left foot and right hand will be in, and those two will be yang, yang. Do you get me? If you do, please reply 9. So why are we doing this? Because in balanced method acupuncture and all Chinese medicine and acupuncture, we are so focused on 2 things. Balance organs and meridians. Am I right? Nothing wrong with that. That's what we do. But we miss one thing. That's the thing that we miss. Structure. Right? If you do this, the way that I just show you, you're not just balancing organs and meridian. Whatever we do with 12 magical point or or I show you the 12 pattern or whatever, we're balancing organs and meridian, but we're not treating the structure. And once you apply this, you don't know how to treat it, but you're actually treating structure. Okay? But again, we're using distal point, and you're using distal point to balance the structure. If you want to balance the structure properly, you need to combine distal point and local point. Okay? All right. So to treat the structure, you need local points and distal points strategy, two of them. Okay. But at the moment, I'm just showing you the distal point, and when you do this, you include the structure imbalance treatment as well. Okay. One more thing. When you do this, structure imbalance. Okay, I'm not going too deep. It's too hard. I'm afraid I confuse you. You may find some patient they don't have. You can't tell from the shoulder, and you don't know which one. 50-50%, and you have to figure out your way. We have other ways to tell if you can't tell from the shoulder. You can tell from the foot. Okay, I teach that in my workshop. If you can't tell, welcome to my workshop and learn more. Okay. Now, let's go to the question. The Dizziness quiz. The head 3 points are including heart 9, PC6, lung 11. 少冲内关少商 A true, B false. A or B? Thank you. It's B. Head 3 points are including heart 9, PC 9, lung 11. 少冲中冲少商 True or false? A true, B false. Yeah, the answer is A. Number 3. You must needle Dr. Tan's GB point when applying major code 12 to treat dizziness. A true, B false. Number 3. The answer is you must needle Dr. Tan's GB points when applying major code 12 to treat dizziness. A true, B false. So be B, right? You can use GB34 instead of Dr. Tan GB point. Okay, thank you. Number 4, you could needle GB34 instead of Dr. Tan's GB point when applying Magical 12 to treat dizziness. A true, B false. Number 4 is, the answer is A. Yep, thank you. Magical 12 could balance all 12 sick meridians. A true, B false. Yep, A. Thank you. And again, it's not just 12 sick meridian, including 12 sick organs. This is the answer. You can take a screenshot. And I'll send you the link later on. All done? 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Dang, dang. Okay. Now it's time for my advertising. On the advertising part, I want to share with you guys that in my coming up in September workshop, I will throw in a bonus knowledge, and that is navel acupuncture. I know a lot of people know how to do navel acupuncture, but there are some acupuncturists not quite sure how to do navel acupuncture. We use it in our clinic. Okay, it's one of our tools. And how do you apply balanced method acupuncture theory in navel acupuncture? Okay. Now look at this chapter and here with A, B, C, D map. The A map is the 子午流注 map. As you can see that gallbladder meridian is on the top and heart meridians in the bottom. Kidney is on the right, left, and large intestine on the right. So those 4 maps, which one work better? The B map is the opposite. The heart's on the top, the gallbladder is on the bottom, large intestine on the left side, kidney on the right side. Okay. To be honest, I apply A map and B map. They work well. But there are another 2 map, C and D map, which you can see that the heart meridian is on the left side, GB meridian is on the right side, kidney on top, large intestine in the bottom. And the D, large intestine on the top, kidney in the bottom, left side is GB, right side is heart. Then the question is, which one is better? Which one works better? Now, I'm pretty sure that as people in this webinar, you probably mainly do navel acupuncture because a lot of people do this. And I'm pretty sure that most people follow B map. There's a difference of B, A, B, C, D map. There's a way to find out whether they work, which one work better. Now, any of you apply using navel acupuncture in your clinic? Can you reply 1 if you're using that method? Just 1 people? Just 1 person? I don't believe it. Must be more. Surely there are more, right? But anyway, share with you another thing. Give me a minute, I just... Okay. This is last treatment working very well. That hasn't got any... This is one of my case. No burning sensation. And left hand. Very slightly. As you can see that in this case, I apply GB on the top, heart in the bottom, and left side is kidney, right side is large intestine. Right. And then again, I know a lot of people applying naval acupuncture, they put heart on the top and GB on the bottom. And what is the difference? Okay, but anyway, I'll show you this case.
Probably less than one. Okay. Yeah.
Can you, and this patient is got, she suffered from burning sensation on palm. Okay, I'll start it and then you can listen to it.
Consistent treatment working very well. That hasn't got any right hand, no burning sensation. And left hand? Very slightly, probably less than one. Okay. Yeah.
Can you, there is no sensation, burning sensation at the moment?
At the moment, no.
Okay, we'll carry on with the same protocol.
Yeah.
So now the first one we do is pointing to the bottom, which is the heart meridian. And then we do over here, pointing to that side, which is pericardium meridian. And pointing to that direction, which is Szenan-Balance meridian. Then I'm pointing to this direction, over that way, which is, hang on, eh? No active video. Hey, that's funny. Why would that be? Sorry, guys. Can you see the video now? No? That's funny. That is real funny. All right. Let me show you this link. You can watch it yourself. Now you can see it? Okay. Let's continue then. Sorry about that. Treatment working very well. That hasn't got any right hand, no burning sensation. And left hand?
Very slightly, probably less than one.
Okay.
Yeah.
Can you, there is no sensation, burning sensation
at the moment, no.
Okay, we'll carry on with the same protocol.
Yeah.
So now the first one we do is pointing. I'm so sorry about it. Yeah, I don't know why. It's just cut off. Oh, maybe I maximize it. I just keep minimize that. Okay. Can you see the image now? Can you see the video? Can you watch the video now? Does it show you? Loading. Consistent treatment working very well. That hasn't got any right hand, no burning sensation. And left hand?
Very slightly, probably less than one.
Okay.
Yeah.
Can you, there is no sensation, burning sensation at the moment?
At the moment, no.
Okay. We'll carry on with the same protocol.
Yeah.
So now the first one we do is pointing to the bottom, which is the heart meridian. And then we do over here, pointing to that side, which is pericardium meridian. And pointing to that direction, which is Szenan-Balance meridian. Then I'm pointing to this direction, over that way, which is lung meridian. Okay, 4 needles. Right. Thank you. Copy. Okay, sorry if some of you can't see it. Okay, now you can see me. What happened with this patient is
Guys, I'm Szenan-Balance from AcuTCM
what's going
School,
on
and in this video, I'm going to show you.
on the YouTube. Okay, so it was on YouTube, and then you guys can copy this if you want to watch it again, or you haven't watched it, and you can watch it on YouTube. You can copy the link and save it. It's on my YouTube. So this patient came in. We used balanced method acupuncture plus G acupuncture, treat the structure and treat organs in Meridian. It got much better because she's been to other practitioners that hasn't been helping with the hand. It was painful and burning and tingling in the hand, and not just on one hand, on both hands. Okay, and wake her up at night time, often, and she couldn't sleep and couldn't work. That's a lot. And we started to treat with the organs and the balance method acupuncture and G acupuncture structure. It works fantastic. Okay. As we keep going after 5 treatments, and then it seems like the progress is not, there's no further improvement. It's just one and two, and keep coming back a bit. It was 7, 8, and bring it down very low, and it's just not getting any further relief for 2 treatments. And then I said, okay, now we need to apply a different technique. So the same meridian, 6 meridian, and what I did is applying balanced method acupuncture theory on navel, just different points, right? So navel is one of my tools, one of my tools. So I did that. So I did that. So I did that, and it got very much better. And then, but 3 more times, and then we closed case. So this is what happened in here. So I want to share with you that whatever you learn from any practitioner or any method, it works. If it doesn't work well for some of your case, not to worry, because it will come. You will don't chuck it away the method. And one day you may still need the acupuncture method to work, because your current method may not work for you anymore. So in my workshop, I'll show you how to find the point to needle, how deep you need to needle, and which map should you apply on your patient. Okay, there's a different there are different maps in here, but which map is going to work better? What is the manipulation technique? Right? How to find a point? How deep is it? And what patient can you can't use, you can't, never acupuncture is not going to work for everyone. What patient can you treat? Can you use never acupuncture? Because you're in dangers if you use naval acupuncture. Okay, and people don't talk about it, and I want to let you know if you attend my workshop. So this is my workshop details. September, from the 8th to the 10th, in Hamilton. Now this is the fee, 1349 US dollars. If you have attended any of my balance method acupuncture workshop or webinar previously, you're going to get big discount. And if you're interested to learn more, please contact us. Okay. Now the last part is in here. Let me Noted. All right. I'm just about to send you the link for quiz. Okay. For those, if you just log in and you want to get the sign in link, you're too late for it because you should come in the beginning. I post the sign in link twice. One is very beginning. The second time is when it's 15 minutes. If you come, if the webinar started half an hour and you come in, I'm sorry, you're not qualified for it. Okay, you can't get this. Okay, you only get the sign in. You only sign in the beginning of the webinar. You don't sign in the end. Okay, you're too late for that sign in. Now is the complete the quiz link time. And again, I haven't posted yet. This quiz link only for New Zealand acupuncturists. If you're not in New Zealand, please do not complete this. And this link only you have to finish now. Okay. And you must complete the sign in link as well in the beginning. If you haven't done that, you're only going to complete the quiz link, you're not qualified for CPD. Okay. Or you just done the sign in link and you haven't done this quiz link, you're not qualified for CPD. Okay. And again, I'm going to post it now, and I give you a few minutes, you complete it, then you can come back for more questions, and make sure your name and email address are right. And once you submit it, you're going to receive a confirmation email, maybe in your junk mail. Okay, here you go. Here's the link. You can go for it now. If you sign in tomorrow, it's not going to count. Only now. Okay. If you've done that, you don't have to tell me. Do not post anything for the next 3 minutes. Do not put any on the chat box for the next 3 minutes so people can look at the link and click it or copy it. Otherwise, you're going to confuse them. They can't find the link. Changsong, you have to, I don't know why you haven't, but maybe you have to, what is your email address? I can check for you. Thank you very much. If you have any question, you can let me know. Vathanan, thank you. They are high valuable information. Awesome. Jenny Lee, if you miss out, I'm sorry. I don't know why you miss out. It's too late for that one. If you stay in here, you won't miss out. For requirement is you only sign in the beginning, and then done the the sign in link, and then you do the quiz link in the end. Therefore, we'll be able to tell what time you sign in, what time you finish, and then we'll be able to tell you actually stay and for the whole webinar, and then you qualify for CPD. Otherwise, we have no way to prove to ACNZ and NZASA. You know, our system will take the time. When you sign in, there's a time there. I hope it makes sense to you. The answer, I'll let you know the answer. The answer is BABAA. BABAA. You're welcome, Aman. Thank you for your time. Pamela, thank you for your time. Winnie, thank you for your time. Aaron, thank you for sharing, and thank you for your time. Any question? Ayen, thank you. Carol, thank you. Pinful, thank you. Hiromi, thank you. Tianshu Wang, thank you. The Han Lai, thank you. Eugene, thanks for your time. Yongmei, thank you very much. Thank you. Song, thank you. Tai Seng Cai, thank you. I am, thank you. Charles, thank you. Magical 12 do not differ for men and women, right? No, we don't do that. I used to do that, and no, I don't do that at all. Sorry, I misunderstand. No, it can use on either, on both. Men and women, they can still use it. A method of how you decide the science to treat the structure. I think that is the most important thing. I'm going to share a video after stroke. If you have no question, I think some people stay in here. Do you guys have a good method to treat foot drop? Foot drop is very difficult in acupuncture too. No, so I mean no. Left and right are not different for two sections. Not in this case. Not in this case. And when I take pose, yes, they are different. They are different. And if I apply tonify and reduce technique, they are different between men and women. They are different, but not in this case, because I'm not doing reduce. I'm simply just doing balance. I simply balance a meridian. If I doing reduce and tonify technique, they are different, but not in this case. Yeah. Do you guys have a good method to treat foot drop? In very difficult cases, would be balance method acupuncture. It didn't work well with foot drop, with distal points, but I worked out a way to make it worse, make it work, not worse, work. I had a patient came in today after stroke. So I needle it's a left foot job. And I needle the right foot on the in meridian, and then she she got better. She can move easier and walk without with a little bit of dragging foot on the left side. I got a video. I'll make a video and put on my YouTube and share everyone. Share with everyone. Okay. So yeah, and I teach that in my workshop, how to treat foot job as well. It's simple, very simple. It's all in my workshop contains in there. It's very simple. I've treated a couple recently, and they all get instant relief, instant results. Okay, that's it for tonight. Thank you for all your time, and I'll see you next week. Next week will be the last one. Just making sure I am actually. We had 150 people done the the quiz, okay, but we have 162 people complete the sign in link. So there is 12 people out. Right, guys. Thank you. See you next week. Is it next week or next time? Let me check. Let me check. Okay. I will send out. I always send out. I always send out reminder in the email a day before or the same day, depending how busy I am. Let me find out. Let me find out. Let me find out the last one. Okay. UTI. Oh yeah, UTI is on the 19th. Is it? Yeah, 19 of August. Not next week. Not next week. Okay, 19. UTI is on 19. Why is on 19? Oh, I think because we have another. Because I have acupuncture 10 common one that we have we have about 40 people join the webinar. It's $150 one. I share more on that 10 common webinar. Yeah, I think next week is 10 common one. Next Saturday. So I'm not doing the free one. I do a paid one, paid webinar. Okay. Yeah, Sati, that's right. Next week we're talking about numbness and feet, right? Okay. I'll see you next week. See you next Saturday, Aaron and Sati. Next week is the 10 common conditions. Okay. Thank you, guys. Have a good day. Have a good night. Have a good weekend. See you.